The COVID-19 pandemic has had a major impact on all of our lives. But in the face of all of these challenges, Allied Pacific has some good news. Allied Pacific will soon begin offering drive-through screening for COVID-19. But those without symptoms will not be pre-screened or scheduled for a drive-through exam.
We are embarking on a campaign to test the Allied Pacific members. We understand that today, going forward, the testing will be what we call the smart testing or the targeted testing, meaning that we will not be able to test everybody. We'll only be able to test those who meet the criteria, and we would have a list of the criteria publicized with our primary care physicians. So the PCP, the primary care physicians, will start out by screening those members and determine whether they are eligible or they should be candidates for the testing. So we'll receive those requests, and we have an internal process at Allied Pacific IPA to contact the patients for further screening, and then we'll give them an appointment to come to our test site. But please understand, we will start by testing those who are at the highest risk. So be patient with us. Once we get all the supplies and test kits promised by our federal government, as they come in more, we'll ramp up the campaign and widen the scope of the testing.
The primary care physician will perform a phone screening to first ascertain whether or not the member has a fever accompanied by a cough and/or increasing shortness of breath. If the member has experienced travel exposure or had direct contact with a COVID-19 patient. If any of the above criteria are met, the primary care physician or Allied Pacific healthcare provider will complete the COVID-19 testing request form. This form will then be faxed to Allied Pacific IPA's Member Services Department.
There are patients, whatever reasons, cannot reach their primary care physicians. We do have a backup plan. We have our urgent care center stepping up to take care of those patients, and there is a urgent care number, a hotline that these patients can call, and our urgent care staff will be able to act on behalf of the PCP.
This questionnaire will ask the following. In addition to COVID-19 symptoms, are you an individual that is 65 years or older with comorbidity, that is someone with diabetes, COPD, cardiovascular disorder, or CVA?
So starting with those with lower respiratory symptoms, meaning coughing, right? Meaning that the lower respiratory tract is being diseased. And with fever, that will be the first criteria. And then we'll move on to those 65 or older, which is our most vulnerable population. So those 65 or older with comorbidities, such as diabetes, cardiovascular disease, right, immunocompromised, and so on. We also want to extend the testing to those ladies, women, that are pregnant or during their late pregnancy with symptoms. And again, as I spoke earlier, the immunocompromised patients, such as the cancer patients, those with chronic renal diseases. But the important thing here that we need to remember is they have to be They have to be symptomatic. If they're without symptoms, there will be no reason to test anyone at this point in time.
Should the patient meet the criteria, an appointment date and time for the drive-through screening will be scheduled. When you arrive for your appointment, please have your driver's license or photo identification ready, and wear a medical mask at all times to protect yourself and the screener. And please, don't use Uber, Lyft, or a taxi. Upon arrival, please do not open your door or lower your window unless directed to do so. Please remain in your car the entire time and turn your interior air circulator on. Upon arrival, a pre-screener will approach your vehicle. Please show your ID to the pre-screener by placing your ID against the window with your name facing out. After your appointment and identity are confirmed, you will be directed to a designated parking space. A nurse in full protective gear will then approach your vehicle to begin the process of collecting a sample. The first screening will test for influenza A and B. The nurse will ask you to roll your window down and tilt your head back so that the back of your nose can be swabbed. After this is completed, please roll your window back up and remain in your car. The influenza A and B test results will be available in approximately 15 minutes. If the testing results for influenza A and B are positive, it will not be necessary to proceed with the COVID-19 test. But if the testing results for influenza A and B are negative, the COVID-19 test will be administered at that time. The nurse will ask you to roll down your window and tilt your head back so that the back of your nose can be swabbed again. Once this test is done, you are free to leave, but you are required to be self-isolated until the test results come back. Our medical team will contact you within 3 to 4 days with your test results. And remember, if you have developed severe symptoms for COVID-19, you should seek immediate medical attention. We at Allied Pacific sincerely hope none of our members require the COVID-19 drive-through screening process. But if you need us, rest assured we will be here, and Allied Pacific will always be ready to help.